think you need all of those. Insiders, outsiders, really insiders, to make a research relationship blossom. I think some of the earlier discussions where it's more, it has to be people from the community doing the research, but that can be kind of an insular view, right? Like research in communities don't develop in a vacuum, right? And Canada doesn't develop in a vacuum either, right? So I think it's more about respecting that there's kind of value all the way around, and taking that approach rather than just an insider-outsider only approach. And we're all insiders and we're all outsiders all at the same time, the same project, in the same community, right? Just depends on how we position ourselves at that particular moment. And we have these barriers around perceptions of research, that have gone, research that has not turned out well in communities. So we have that kind of hurdle to get over. So I think an extra emphasis on relationship building is needed.
The mothering project, the Anishinaabe name that they've given, because they went through a naming ceremony for it, is Manitou Ikwe Kagikwe, and it's a project that's running out of Mount Carmel. And what they do is they support women who are either pregnant or early parenting and are substance involved. So regardless of whether they want to quit using substances or not. So it's a harm reduction based program, which is different because most messaging to pregnant women is complete abstinence, and women who are using substances of any kind while pregnant are very highly stigmatized. They face a lot of moral judgment, and that's often a barrier to care. And then also doing a lot of advocacy in their relationships with child protective services. So trying to help moms go home with their babies once they deliver, get children back if they've already been apprehended, and supporting them in their parenting role of it. Often in an evaluation, the primary audience is defined as whatever the funding organization for the program is, but we defined our primary audience as the actual Women's Advisory Council and the women who are involved in the program. So that shifted how we thought about the evaluation and the design. In an urban setting, I think that it's a lot more difficult to identify what the appropriate kind of community representation is. With my signed agreements in the past, although the university states that the intellectual property from the research belongs to the university, I've always gone through the process to clarify that we are stewards of that, whatever data that is, and that the actual ownership stays with the community. So in this case, the ownership stays with the Women's Advisory Council on behalf of the project.
Well, I think like most students who have an Indigenous background, like many students, I would say, I wanted to learn about my kind of identity, and for me, because I was academically, I was interested in academics, the best way for me to do that was through kind of research, engaging in research. So learning about, who I was, the pathway to do that was through research for me. So when I was thinking about what was a topic that was of interest to me, because I know, only 50% of people who start a PhD finish a PhD, so I knew I had to do something that was meaningful to me in order to complete it. And the work that I'm doing around maternal child health, I'm not really interested in what is going on in terms of like mom and baby's health. I'm interested in what's happening in terms of mom and baby and their lives and in the community's lives, and how does that interact with culture in the community. Recently, the project we're just getting started on right now is returning maternity services to Norway House. So having access to care is a social determinant of health. So I worked with the Assembly of Manitoba Chiefs in terms of drafting a research agreement. And so, in a traditional academic project, the principal investigator would hold all the data. She would be in charge of everything, dissemination. In this case, this is a project that the community asked me to do. It's not my community. I'll need some things, I'll need to publish, but those are all things that we negotiated in our research agreement. I think what I ended up doing was really relying on my community advisory circle that I have set up to guide what is a reasonable thing to expect from the community and what is reasonable for them to expect from me, and we came up with a research agreement with the chief of council that instead of me being in control, the community is in fact in control of their own data. So there's this negotiation that takes place that sometimes works and sometimes doesn't. So that kind of is complex, I think.
And I think that the investment in the relationship has really paid off, because one of the things that they said at that ceremony was they don't really think of us as the external evaluators anymore. They think of us as part of the team. So that's, I think, really nice. And yeah, we have a high level of respect. We have to constantly work at the ongoing trust, especially because this is a group of women who are heavily stigmatized and heavily marginalized within our society. And it's intense sometimes. Like if we're working with the woman, and lots of them display so much strength, but they've been very generous and shared really heartbreaking stories of, struggles they have with housing, with kids being apprehended. One woman that we talked to, and I don't want to say anything that would make her identifiable, but she worked for several years in order to get all her children back. And being a mom myself, it's hard to sit there and listen to that and imagine what that would be like, to have your kids taken away, but all of the work that you have to go through in order to get them back, to be judged as good enough to parent your own children, but also the strength that she showed to be able to do that. But it's hard to listen to those stories and kind of not take the emotional weight on.
Yeah. I mean, that's I wouldn't be able to travel into the communities and have any connection if I didn't have relationships with that community to get there. I've had I haven't really had a lot of challenges in terms of going and working in the community. I've been welcomed and mentored and supported, and I think that's because I enjoy the process of relationship building. I think it's to me, it's just kind of socializing and getting to know people. I have a natural curiosity about people and where they're from and what are things that have happened to them that have shaped their perception of the world. And as I tell my students, doing work in communities, part of it is kind of personality based. You have to be respectful to people and interested in them and their community and what they're interested in, and be likable, I guess, is another piece. So.
I don't think you could have research that's beneficial to communities unless you have this kind of partnership. So I think if you weren't part of a partnership where there is trust, where there's respect for the expertise and the knowledge that the community holds, where there are shared goals and aspirations that are being met by their research, that the tendency would be to continue to serve the researcher's agenda instead of the community's agenda. And I think that can breed mistrust.
I hope that governments see the importance of communities having some self-determination in terms of their own health systems, and that involves meaningful engagement and partnerships with researchers and universities, so we can all work together to address the concerns that are so prevalent in communities. I'm hoping that's where it's going to go. I think any approach to take away self-determination is going to result in continued health disparities.
Hey, 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 hey.